Hey guys, I'm Dr. Pruner here with Foot and Ankle Associates of North Texas, and I'm super excited because today we're introducing our new treatment modality that we're bringing to the practice, and it's called the MLS Laser. It's right here, and the MLS Laser is a phenomenal treatment option for a multitude of different things that we see here every day. These kinds of issues can be neuropathy, it can be ankle sprains, acute or chronic. You can have Achilles tendinitis or any of the tendon issues that you see are suffering with neuropathy. Even patients that are planning on having surgery and getting laser during the surgical process, all of these different things definitely have been shown to help in so many different ways with relieving pain in ways of not needing surgery at all to, if you need surgery, making sure your surgery healing process can go even more smoothly. So we're going to talk about the commonly asked questions that a lot of people that are considering using this MLS laser therapy would want to know. So the first question that a lot of people have is, what is the MLS laser? We see a lot of different laser treatments advertised out there, some for hair, some for skin, some for nails, but this one is particularly targeting for the musculoskeletal or the pain aspect for patients. And this isn't just a machine that's used for the foot and ankle, which is what we'll be using it for in our practice, but this type of machine is used for other types of ailments like shoulders, backs, hips, knees. So I'm going to be focusing on that particular area of the things that we treat with the MLS laser. So what the laser is, it's an FDA approved device that essentially uses the strength of a laser's light to go directly into your cells and target them specifically in the areas that you're having your pain to produce the types of chemicals and enzymes and things that will create better healing and decrease scar tissue. It has been shown to work in both the acute setting where you just recently had an injury, or even in the chronic setting where it's something that you've been dealing with for years that just hasn't gotten any better, and even for people that are just having undergone surgery that can get that during their healing time so that they have less scar tissue buildup and less inflammation as the healing process goes on. So the next question is, how is this particular laser different from other lasers that you see advertised, like in physical therapy offices or even other podiatric offices, chiropractic offices, for things that are going to treat your pain? And the main thing with the MLS laser is it's not just one laser, it's actually two different FDA approved laser systems. So one laser that is used in the beam is directly to target the pain sensors in your nerves to basically silence them and tell them to not tell you that that area is painful, which of course is extremely beneficial. But the second one that I like the most is the inflammatory beam that is also in this laser system that decreases the amount of inflammation around the area of the chronic or acute injury, which that means that as you're healing something, the less inflammation, a little bit is fine, but if you have too much, that's how scar tissue builds up. That's whenever you're walking and you can only make it a certain amount because it's swollen and it hurts you. That's where this laser comes in. So you get both of those at the exact same time in a very short amount of time as well. So the next question is, what is it that this MLS laser treats? And that's a very exciting answer because there's a lot of things that this laser treats. It can treat muscle sprains, strains, ankle injuries, Achilles tendinitis, and any tendinitis for that matter. It can treat neuropathy. This can treat your neuroma. This can treat capsulitis, any kind of inflammation, issues that you're having, including arthritic pain. Chronic or acute, this MLS laser has amazing qualities to really help the healing process for whatever it is that you're suffering with currently. So the next question is, how often do you need to get this if you're doing 6 or 10? And the answer is, we recommend doing 2 to 3 treatments per week for those groups of sessions. The reason for that is also, again, based on research, because these treatments build upon each other. You don't do more than one within 24 hours, so you want to get them spaced out just enough, but yet close enough to where you get the most benefit from the procedure itself. So what are the contraindications for this laser treatment, or who cannot get this laser therapy? That is a very short list, I'm happy to say, and the only individuals that do not have the ability to get this laser therapy is, 1, any individuals that are sensitive to light treatment of any kind, and group number 2 is pregnant individuals. There is a third category of a certain age children while children can get them, if it's anywhere near a growth plate, we do not use the laser therapy within the areas of the growth plates. So that leads into the next question, which is it safe for children? As we know, children like to be goofy and do crazy things, and they also want to heal very fast. They don't like to be held back for a prolonged period of time. And the answer is yes, this laser is completely safe for children at certain locations, which is why it's extremely important for you to consult with your doctor before proceeding with any of these laser therapy treatments for your kiddos. The next question, which is probably the one that we hear the most often, is does it hurt? And the answer is no, you feel nothing. You actually don't probably even think anything is happening. This laser is very unique and special in that you don't feel any heat, vibration, or tinges of pain while you're having this laser therapy. So you can rest assured that this is not something that you will be suffering just to get this treatment benefit. So then the next most commonly asked question is one that I've already touched on a little bit, which is how many sessions will you need? And that is going to be specifically given instruction by your doctor. At our office, at our Grapevine location, which is where our laser is located, we recommend, based on the research, either 6 treatments or 10 treatments for the area in particular that you are being affected by with pain. This is because it does not benefit you to have just one treatment and see how it goes. The benefit will only be visible to the point to where the research tells us that you will get that benefit. So it's in 6 package or a 10 package for whatever condition you have, and your doctor will tell you how many that you need to get. Another very commonly asked question is how much is this going to cost you? While this is an FDA-approved treatment system for many different things, it is still not insurance covered. So with that being said, the pricing can vary depending on how many treatments you're going to need, how many locations that the treatment is going to need to be applied to. And so if you do have any questions about that, or if you've already been seen in our office and you've been given the prescription, you need to call the Healthy Steps shoe store and they will give you the pricing for the direct prescription that your doctor has prescribed you. So the last question is, while you're getting this treatment, how often do you need to be seeing your doctor? And the answer to that is pretty straightforward. The treatment, if it is 2 to 3 times a week, depending on however many you need, a treatment follow-up is required every 2 weeks so that we can also watch the progress and see if there's any changes that we need to make to your treatment plan. So now we're going to take you into the laser room and we're going to show you what it's like for you as a patient if you were to schedule the laser, the process of everything that you would be going through, timing, and positioning. Hey guys, I'm going to now show you an example of if you were to set up the laser, what the process would really look like. So whenever you come, you're going to check in through the shoe store for your appointment time and you'll be taken into the laser room. And then the laser tech will then begin to prepare you into the position and the laser into position for your treatment. So as you can see here, we have our wonderful volunteer that is going to be getting some Achilles tendinitis treatment. All right. So the most important thing is position. So she's going to be relaxed and also have her feet dangling to where they're not going to have any pressure. So no weight bearing position for this laser. Next, we have our ruler here, and this is because the treatment needs to be 8 inches from the laser beam to the skin. So I put my laser position here, and we raise the patient up or the laser beam itself until it's 8 inches from the patient. So now that we have her in her position, we all wear our safety glasses. It's extremely important that you keep your glasses on during the entire process until the doctor says it is safe to remove the glasses. All right. So now that we have her here, we have already programmed in for all the different types of treatments that we're going to use. So everything is ready to go for your specific diagnosis. In this case, it's Achilles tendinitis. So I simply just click the treatment that you're going to need. So now that we've selected the treatment that our patient needs, you can see this laser beam is currently moving, but it's not on. It's telling you exactly the location that you're going to be getting the treatment applied. So at that point, we're going to position you to where the area is that you have your most pain, and then we're going to start the treatment. Treatments tend to last anywhere from 8 to 15 minutes, depending on the area that we're treating, and that is per session. The other really exciting thing about our MLS laser is not only does it have the 2 laser beams that are in the treatment itself for pain and inflammation, it also comes with a handheld. And the handheld is really important because in the foot, it's a very complex and twisty structure. It's not like a leg where it's a straight area that we can work on. Sometimes we do need to get into pinpointed locations that the laser itself may do a good job at, but the handheld will add to that experience. So what we do is if we need to add on any kind of treatment, or if this is the only way we're going to be able to do that treatment, we can use this directly onto the skin itself, which again doesn't cause any pain, any warmth, and increase the likelihood of progress to heal your pain.